Hello, everyone. I am so excited to introduce you today to Howard Leonhardt as part of our Plug into Devin series. Howard runs Leonhart Ventures, and he's doing just some amazing stuff. I'm fortunate to serve on his advisory board, and so I was able to convince him to come on the show today. Howard, welcome. We're thrilled to have you.
Devin, thanks for inviting me on, and I'm glad to see that you're healthy in this crisis, and hope everyone listening is staying healthy.
Well, thank you, Howard. You know, you are doing some amazing things in biotech, and your roots are in California, but you've moved key parts of your operations here to Utah. Tell us a little bit about what you're up to.
I'm very lucky to live in both places and love both places. And yes, in 2015, a few people, including yourself, that I'd heard about Utah being a great place to open up research operations for a company like ours that does biotech and medtech research. And Dr. Amit Patel, who was head of the cardiac regeneration program at the University of Utah, he had said to me a couple of times when we came across each other at conferences, he said, "You got to come to Utah because we really have a great setup to do research." And then I met yourself and David Robinson, Dinesh Patel, kind of on my first scouting visits. And all of you just were very convincing. Come to Utah, and it's turned out to be an amazing experience. So we actually moved there in November of 2015, and I got an apartment in Salt Lake City, and ended up meeting my future wife there. We now have two kids, a 3-year-old Kai and a 2-year-old Hallie, and it steered the course of my personal destiny as well. But on the research side, we set up a laboratory there. We now have 7 full-time employees, a whole bunch of contractors and consultants that serve, including you as an advisor, and it's gone amazingly well.
Well, the stuff that you're doing is just mind-blowing. And I want to just help put this into perspective for people. You're working on a way for humans to regenerate their organs after they fail or when they start to fail. So you could regenerate a heart, a kidney, a pancreas, maybe even an eye. You're already doing it with hair, with teeth straightening. You're doing it with skin. Tell us about the amazing stuff you're doing.
Thanks so much for this opportunity. We're so excited about what we're doing. It's been a long road for us. Working with Dr. Ray Scow and Dr. George McGovern in 1988, we implanted muscle stem cells into an infarcted heart of a large animal and was able to show a recovery of the injured part of the heart back to beating, pumping muscle. And we've been at it ever since then. In 1985, Dr. Robert O. Becker published the book, The Body Electric. And right away, I had bought the book. And around 1987, 2 years after the book was published, I gave him a call and I said, "I love what you taught in your book, and I would like to collaborate in research with you." And we began a research collaboration. And basically what we're doing at Leonhardt's Launchpads, which is the innovation accelerator arm of Leonhardt Ventures. And we have Leonhardt's Launchpads Utah, which is a Utah corporation. What we do is take the convergence of everything we've learned related to stem cell therapy for organ regeneration and combine that with everything we've learned in using bioelectric signaling to help the regeneration of organs. And in that bioelectric signaling, we've patented signals for stem cell homing. So if we point this bioelectric signaling sequence to your knee, your own stem cells migrate to your knee. If we point it to your heart, your own stem cells migrate to your heart. And then we've gone on to identify signaling sequences for over 30 different protein expressions that contribute to organ regeneration. And the quick summary is 800 patients have been enrolled in clinical trials. We have data on about 500 of those 800 already. Much of that has been published. We're running about an 83% treatment success rate, meaning whatever we sought to do to regenerate a bladder so people didn't have urinary incontinence problems, curing men of erectile dysfunction. We've completed 105 patients where we've had between 90 and 150% improvement of the function with the rectal dysfunction. And we've had, as you mentioned, hair regeneration, skin regeneration. We're actively enrolling in a kidney regeneration study. And we're getting more and more deep into the more serious organs. We're restarting our heart regeneration. We had previously gone through studies with heart regeneration where we just delivered muscle stem cells alone, nothing else, and we only injected them one time in the scar tissue of the heart. And we took that through pilot, phase 1, phase 2, and phase 2-3 studies, mostly in the United States, 33 leading centers in the U.S. And basically what we learned from that is one-time injection just wasn't enough. It was a great thing to do, and we could improve upon injecting those stem cells in the infarcted heart tissue, the post-heart attack heart tissue that was damaged, by supplementing the stem cells with kind of an egg yolk, exosomes, and I'll save the whole long description, but a simple way to describe it that everybody can understand is kind of like an egg yolk, a whole bunch of good things that cells love in a mix. And now instead of just injecting that once, we have a pump that goes under the skin with 2 silicone septums, and we refill it every day with a refill of 2 milliliters of stem cells and growth factors, or the egg yolk, and it slowly infuses into the damaged part of the heart every single day. And then we supplement that with the bioelectric stimulation with these 30 different signals, which also include a whole host of signals for managing inflammation. I could go on for hours to talk about technology.
Yeah. That's amazing, Howard. It's just amazing. Where can people go to learn more about that, Howard? I know we can't cover it all today. Where can people learn more?
Thank you very much. LeonhartVentures.com is the main website, and Leonhart is my last name, and that's spelled Leonhardt Ventures.com. And from there, you can navigate. We have a development pipeline button, and there you can see where we're at with the stage of development. We have 17 products that are at clinical stage of development, 13 that are in preclinical studies. And one of them that's an offshoot that we did touch on when we spoke last is we never intended to enter cancer. We're trying to regenerate organs. But while we were trying to proliferate cells, we accidentally stumbled on a signal that stopped cell division. And while we were trying to grow new blood vessels into failing organs, we accidentally stumbled on a signaling sequence that actually halted blood vessel growth and retreated blood vessels from the organ. And those were not very useful discoveries for organ regeneration, but we started to do experiments on seeing if we could inhibit cancer tumor growth. And we have some early data that encourages us. And now we have 9 issued patents for bioelectric treatment of cancer. And we can't claim that we've cured cancer yet. And we can't claim that we've had a great success there yet. But we really have high confidence that this is going to be an alternative to people instead of getting chemo or radiation. And of course, like a lot of things that are breakthrough, we're not alone in this. And there's a number of other researchers that have gotten further along in clinical studies than we have. And they have proven that electromagnetic signaling can be a good alternative to chemo and radiation. And one company called NovaCure, another company called Post Biosciences, and a few more have demonstrated successful clinical results. And we think we're on the path to do the same. So
that's amazing. That's amazing. Howard, what's your superpower before you go?
My superpower is recruiting really great, amazing people like yourself to help me, because there's only so much that I can do in a day. And I'm so grateful to have people like yourself that, basically without any cash pay, donate your time and hope that the advisory option shares that you get might someday have some value. But if I had to say anything, it was, being lucky enough to be able to recruit great people to help.
Well, thank you, Howard. Thank you very much for being with us today, and we wish you every success in all the amazing work that you're doing.
Thank you very much for the opportunity. Stay safe.
All righty.
Stay healthy.
Thanks. Let's do some good.
Thank you.
I'm Devin Thorpe. For the last 8 years, I've been working full-time to eradicate extreme poverty, improve global health, and fight climate change. I've concluded that the best way for me to continue my work is to run for Congress to represent the people of Utah's 3rd District. In Utah, we have common shared values. Those things unite us. I believe passionately in our ability to come together, and I believe that working together, we can solve Utah's problems. I'm Devin Thorpe. I'm a Democrat. I'm running to represent the people of Utah's 3rd District.
I'm Devin Thorpe, a candidate for Congress, and I approve this message.